All right, I'm Stefan DiLorenzo with WKM News, and I'm so happy to be able to present this episode of Medicare, series of reports we're giving you, information about Medicare. Each episode will be led by Mr. Holly Roberts, here, a local insurance agent on this and resident of Madison, Indiana, and he's going to be focusing on Medicare specifically. Welcome back, Holly.
Thank you.
Thanks.
I appreciate you letting me do this.
Yeah.
It's a pleasure to be with you again and to help all of you in the area who are on Medicare or maybe who soon will be on Medicare.
Okay, Holly, what do you have in store for us today?
Well, I thought might be best to cover some of the basics of Medicare. But first, I want to remind you that we are now in the open enrollment time. So if you want to make any changes, now's the time. It runs from October the 15th through December the 7th. So I just wanted to remind you of that.
Yeah, and for episodes like this, you can view them on WKMnews.com in case you missed a previous episode or you want to see them in full later on in case you can't watch it when it's playing on TV 15. Just go to WKMnews.com and click the public service announcements page. That's where they're going to be at. Good. And you can watch these. If you can't find them, just hit the Contact Us button. We'll be more than happy to help you find them.
That's great. Thank you.
Yep. So, give some of the basics about Medicare, if you would. Sounds like a great idea. Let's get started.
Okay. Well, Medicare is a health insurance program administered by the federal government. It's actually run through CMS, and that stands for Centers for Medicare and Medicaid Services. So it's primarily for two groups of people: those who are 65 and older, or those who are under 65 but are on disability. So when you go on Medicare, you'll notice on your red, white, and blue Medicare card that it has two parts, Part A and Part B. So real briefly, Part A is hospital insurance. Basically, the best way to think of this is being inpatient. So if you have been admitted into the hospital, then Part A covers that. Now, Part A, for the vast majority of people, does not cost you anything because you've paid into the system over the years through your Social Security and Medicare taxes. So there's really no cost for this for you to have. So again, Part A is for inpatient expenses. The second part is Part B, and that's called medical insurance. And the best way to think of this is being coverage for outpatient services, such as doctor visits, labs, x-rays, things like that. Anything where you have medical treatment, but you're not admitted into the hospital. Now, for this coverage, there is a premium, and this cost, at least for this year, is $104.90 a month. And for the vast majority of people, this is automatically withheld from your Social Security, so they take it out before they send you your check. So really, that's the basics of Medicare, Part A and Part B.
Is that all there is to it? Because I thought for sure I've heard of a Part D before. Is there a Part D? And if so, what's that about?
Well, you're right. There is a Part D. Okay. But technically, it's not a part of original Medicare. Part D is the part of Medicare that provides outpatient prescription drug coverage. But this is only provided through private insurance companies that have contracts with the government, and it's not through the government itself, okay? So here's the thing. If you want Part D, you have to specifically choose to get Part D, okay? And so if you have original Medicare, then you need to go get you a separate prescription drug plan. And I just want to remind people again that this open enrollment time that's coming up, that's October 15th through December 7th, is the time for you to do so. So if you don't have one now, now's the time to get one. And if you do have one, now's the time to change. So just wanted to remind you again.
Okay, that's great information. I'm learning a lot doing this series. I'm having a lot of fun doing this. I hope the viewers are enjoying this as well. But as listening to you, we've got Part A, Part B and Part D. Is there a Part C? Am I missing that, or is somewhere? What's going on there?
Well, believe it or not, the government did know their alphabet, and so they did include a Part C, and that, you're very observant. That's a good question. Actually, again, there is a Part C, and this is known as Medicare Advantage. Part C is not a separate benefit. It's part of Medicare, and they have a policy where you can go outside of the Medicare, original Medicare, and get insurance through a private insurance company to provide the benefits. And they are usually HMOs and PPOs, okay? And if you want, you can choose to get your care through a Medicare Advantage plan rather than through original Medicare. They have to offer at least the same benefits as original Medicare, but they can do it by using different rules and different costs and even restrictions. The biggest difference is that they almost always use a network. So if you stay in the network, that's good. You pay less than if you go out of the network, okay? And another thing is there's a premium for this. So you'll be paying the $104.90 just to have the Medicare coverage, and then you'll also be paying a premium to the insurance company that you get this plan through, okay? And again, if you want to enroll in a Medicare Advantage plan or change from the one you have, now's the time to do it during the open enrollment.
That's really valuable information, I think. I got a question for you off that. Does Medicare pay 100% of the cost?
Well, I wish they did, but no. The fact is they don't.
Okay.
In fact, I guess the best way to do this is explain how things are covered and what Medicare pays. So, do you remember I just talked earlier about Part A for being inpatient? Mm-hmm. Well, it has a deductible of $1,216 this year. It may be even more next year. And so remember, a deductible is the part that you pay before the insurance starts paying their part. So, once you're admitted into the hospital, you're responsible for paying this $1,216. And this is not an annual deductible. This is a deductible that's charged to you each time you're admitted into the hospital, as long as 60 days or more has gone between admissions. So for example, let's say you were admitted into the hospital in February for pneumonia. Well, you'd have to pay the $1,216 for that. And then let's say maybe in May or June, you were admitted into the hospital again for, I don't know, maybe gallbladder surgery. Well, you'd have to pay another $1,216 because you had been admitted twice and more than 60 days went between it, okay? So, as you can see, they don't pay 100%. Secondly, if you're due inpatient under Part B, it does have a deductible also, and it's an annual deductible. So each year, starting January 1st, you have to meet a deductible of $147, at least for 2014. Then once that deductible has been met, you pay 20%. So Medicare will pay 80 and you'll pay 20. This is called co-insurance. This is where you share the cost. So they'll pay 80 and you pay 20. So you can imagine that this really adds up. So having original Medicare is good, but if that's all you have, then you could still end up spending quite a bit out of your pocket. So that could hurt.
Yeah, you're right. Even though Medicare pays for most of the bills here, the person could still end up paying for a lot. Is there anything that can be done to help the person in that?
Well, yes. In fact, there is, and this is what I kind of recommend. The best way for you to eliminate having to pay large medical bills out of your pocket, in other words, the part that Medicare doesn't pay, is to have a Medicare supplement policy. Medicare uses the term Medigap, but whether you hear Medigap or Medicare supplement, they're the same thing. It's just two words for the same thing. And so, but no matter which term you hear or use, they pay most all of your covered costs. So for example, in that illustration I had earlier where you end up going to the hospital twice in a year, you would have to pay $1,216 each time, which is over $2,400 a year out of your pocket. If you have a supplement, the supplement would pay the deductible for you. So you wouldn't have to pay the $2,400. The supplement would do it. So I guess my best advice to people on Medicare would be this. If you can afford it, if you can, I recommend that you get a Medicare supplement policy to go along with the original Medicare. Because quite often the amount you pay in premiums, and there is a premium for the insurance, the amount you pay in premiums though is usually less than what you would pay out of your pocket. Like one hospital deductible would probably pay for a whole year's worth of Medicare supplement insurance. So that's what I would recommend.
Yeah, that sounds like really good advice for somebody out there that needs that, absolutely.
Right.
How can they obtain a medical supplement policy? Can they do that during the open enrollment period?
Well, yes, technically they can. However, open enrollment does not specifically apply to Medicare supplement policies. Open enrollment is the time for you to make changes or go in for the first time to Medicare Advantage plans and prescription drug plans. Because technically, you can apply for a Medicare supplement policy at any time during the year. The only thing is this: when you go on Medicare at age 65, you have a 6-month window where you can obtain a Medicare supplement policy, no questions asked. We skip right over the health questions, it's guaranteed. So you could be sitting there having just come from chemo treatment or having just had open heart surgery, and they have to accept you. So don't lose that opportunity. You have a 6-month opportunity from the month you turn 65 years old. You have 6 months. But after that, you have to answer the health questions. You have to go through the underwriting process, which means that you probably could be turned down. But again, you can apply for a policy at any time during the year. Okay? So that was good.
Yeah, that leads me to one final question here. Can you briefly explain the difference between a Medicare supplement policy and a Medicare Advantage plan for us?
Whoa, yeah, I sure can. And there's a very important difference. I mean, they're nothing alike. It's like comparing apples and oranges. So I'll take the Medicare Advantage plan first. Okay, so Medicare Advantage plans have a contract with Medicare, and they are paid a fixed fee by Medicare to take care of you. So in addition to whatever premium you might pay to them, Medicare is also sending them something on your behalf to help take care of you. And generally they're HMOs, which are mainly in and around large cities, or PPOs, which are kind of everywhere else, okay? But because it's through a private insurance company, and around here people are familiar with like Anthem maybe and Humana, just to name a couple, they are the ones providing your protection. So if and when you go to a doctor or a hospital or a lab or whatever, they file the claim with Humana or with Anthem, not with Medicare, okay? So really, you won't even use your Medicare card, you'll use the insurance card that they send to you. And most of these plans also include a prescription drug policy built into it, so they're like a 2-in-1 plan, okay? But they usually have co-pays, so whenever you go to the doctor, you'll have to pay a certain amount out of your pocket. They usually have a network, like I mentioned before, so if you stay in the network, it costs you a little less than if you go out of the network. And they can be kind of complicated at times, but they can be a good alternative to having just nothing but original Medicare. Now, on the other hand, though, a Medicare supplement policy works hand in hand with Medicare. The doctor in the hospital files the claim with Medicare. Medicare processes their portion. Then they automatically send the rest of the claim over to the insurance company. and they pay their part, okay? And so it's very simple. There are no networks. Whoever accepts Medicare accepts the supplement because they work together, okay? If you go to this route, though, you would have to have a separate drug plan because Medicare and the supplement don't have anything to do with prescription drugs. If you have your new Medicare and U-Book, this is a 2014 version, but if you have your 2015 version, which has been mailed out already, look on page 17. There's a wonderful illustration explaining just what I talked about. So anyway, I hope this has been helpful to you, and I've really enjoyed being able to share this information with you this week.
Oh yeah, thank you, Holly. I'm sure this has been helpful to all of our viewers and residents locally here.
So.
If anyone has questions or needs further information, can they contact you?
Yes, they can. Again, my name is Holly Roberts. I'm an insurance agent located in Madison. My primary focus is helping those people who are on Medicare. And you can reach me by calling my office phone number, and that's 273-4191. Call me anytime.
Okay, 273-4191.
Right, that's
Okay,
right.
Perfect. Well, I guess that wraps it up for today. Can you let us in on some of the what's next installment we're going to be dealing with here in the next video?
Yeah, our next episode of this series is going to be strictly questions and answers. I've already started receiving questions from people, and so I'm just going to pick out the best ones, and we're going to read the questions, and I'll give the answers. So, because I know if some people have them, a lot of people probably have those same questions. So, the next series should also be very informative and very helpful. So, I'm looking forward to that one too.
Yeah, I am too. And until then, I'm Stephan DiLorenzo.
And I'm Holly Roberts.
And thanks for watching WKMnews.com. We're here with Medicare Informational with Holly Roberts.
Yeah.
Thanks.
Thank you.
So long, everybody.
Bye.